When I was sent a video about Kris Jenner
My right hip has been driving me crazy.
and the Kardashian clan, I thought it was an error, but robotic hip replacement, now that's something I know about.
The doctor saw my MRI results and he said, you need a hip replacement right away. It's like suddenly I can't do all the things.
It is so incredible that people with arthritis, right, that's supposed to be wear and tear over time, describe that. All of a sudden, I couldn't do this or that. And people think, man, it must not be arthritis because it came on all of a sudden. Well, we don't really understand why it happens that way, but it absolutely does. Arthritis can snap away your ability to do even the simple things
My
like that.
hip goes out. My knee is torn. I have an eye infection.
Just
I
getting
can't
older.
see. I have the TV up too loud. Cory says I can't hear. I'm like, you know, it's like I feel like Humpty Dumpty.
She's not Humpty Dumpty, but I get how she feels. When you have chronic pain, it starts to feel like everything's falling apart. It really drains on you, not just physically, but mentally.
I have tried just about everything to get rid of this hip pain, and it seems to get worse and worse and worse. Like, when was the last time I went dancing, or when was the last time I walked across the room and felt great with a skip in my step?
Did you see that? Even simple movements can be really, really painful when you have hip arthritis. If you're grabbing your leg to move your leg, listen, you need to see somebody.
Hi, Dr. Sniffy. I am. I'm Kris. The pain that I've been feeling seems to be getting in the way of my life. And that is not something that I can really tolerate or have the patience for.
That's it, isn't it? I get asked all the time, how do I know when it's time for my joint replacement? Here we're talking about hip replacement. The reality is it's not all about pain. Pain's a factor, but it's about quality of life. What is that hip not allowing you to do? What is the life that you want to live? And maybe surgery is needed to get you back to your MRI.
From here to here, there's no cartilage, right? You've lost all the cartilage in the center of your hip. Cartilage wears away, then there's bone left. And when the bones touch each other, that's what hurts.
Look, if there's something wrong with you, we're going to figure out what it is. If you're having pain and limitation, we'll do whatever we need to do to figure it out. Now, typically, hip arthritis, we can diagnose with just an x-ray, but sometimes you do need a MRI that shows more detail or even a CT scan. Sometimes we get all of them, but whatever it takes, we're going to find your problem.
What is the cure for that?
Hip replacement.